Respiratory health and common breathing conditions. Asthma. Asthma is a chronic respiratory condition characterized by inflammation of the airways, leading to symptoms such as wheezing, shortness of breath, chest tightness, and coughing. What are the common symptoms of asthma? Asthma typically presents with symptoms like wheezing, shortness of breath, chest tightness, and coughing. Wheeziness. Wheeziness refers to a high-pitched whistling sound produced during breathing. It is often associated with narrowed airways, as seen in conditions like asthma. What causes wheeziness in breathing? Wheeziness is often caused by the narrowing of airways, leading to a high-pitched sound during breathing. Conditions like asthma can contribute to wheeziness. Shortness of breath. Shortness of breath, or dyspnea, is a sensation of breathlessness or difficulty breathing. What is shortness of breath, and what conditions can cause it? Shortness of breath is the feeling of not getting enough air. It can be caused by respiratory conditions like asthma, bronchitis, or even cardiovascular issues. Coughing. Coughing is a reflex that helps clear the airways by expelling irritants, mucus, or foreign substances from the respiratory tract. When should persistent coughing prompt medical attention? Seek medical help if a persistent cough is accompanied by shortness of breath, chest pain, blood, or lasts more than a few weeks. Chest tightness. Chest tightness is a sensation of pressure or squeezing in the chest, often associated with breathing difficulties. What are common causes of chest tightness? Chest tightness can result from anxiety, heart-related issues, respiratory conditions, or muscle strain. Croup. Croup is a respiratory infection that primarily affects young children. It causes inflammation of the upper airways, leading to a barking cough and stridor, a harsh, high-pitched sound during breathing. What distinguishes croup from other respiratory infections? Croup is distinctive for its barking cough and the presence of stridor, a high-pitched sound, due to inflammation of the upper airways. Influenza. Influenza, or the flu, is a contagious respiratory illness caused by influenza viruses. It can lead to symptoms like fever, cough, sore throat, and difficulty breathing. How does influenza affect the respiratory system? Influenza is a viral infection that can cause respiratory symptoms such as fever, cough, sore throat, and in severe cases, difficulty breathing. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs, causing them to fill with pus or other liquid. It can lead to symptoms like cough, fever, and difficulty breathing. What distinguishes pneumonia from other respiratory infections? Pneumonia is characterized by the inflammation of air sacs in the lungs, leading to symptoms like cough, fever, and difficulty breathing due to the presence of pus or liquid. Bronchitis. Bronchitis is the inflammation of the bronchial tubes, which carry air to the lungs. It can result in coughing, mucus production, and difficulty breathing. What are the main symptoms of bronchitis? Bronchitis is characterized by symptoms like coughing, mucus production, and difficulty breathing due to inflammation of the bronchial tubes. Pleurisy. Pleurisy is inflammation of the pleura, the double-layered membrane surrounding the lungs. It can cause sharp chest pain that worsens with breathing. What are the main symptoms of pleurisy? Pleurisy is characterized by sharp chest pain, especially during breathing. The inflammation of the pleura, the membrane around the lungs, contributes to this discomfort. Respiratory syncytial virus, RSV, infection. RSV is a common virus that can infect the respiratory tract, particularly in young children. It may lead to symptoms ranging from mild cold-like symptoms to severe respiratory distress. What makes RSV infection significant, especially in children? RSV is notable for its impact on the respiratory tract, causing symptoms from mild cold-like issues to severe respiratory distress, particularly affecting infants and young children. Tuberculosis, TB. Tuberculosis is a bacterial infection that primarily affects the lungs. It can cause symptoms like persistent cough, chest pain, weight loss, and difficulty breathing. What are the typical symptoms of tuberculosis? Tuberculosis often presents with symptoms such as a persistent cough, chest pain, unintended weight loss, and difficulty breathing, as it primarily affects the lungs. Sarcoidosis. Sarcoidosis is an inflammatory disease that can affect various organs, including the lungs. In the lungs, it may lead to granulomas, causing breathing difficulties. How does sarcoidosis impact the respiratory system? Sarcoidosis, an inflammatory disease, can form granulomas in the lungs, affecting their function and leading to breathing difficulties. Interstitial lung disease, ILD. Interstitial lung disease refers to a group of disorders that cause inflammation and scarring of the lung tissue, affecting the ability to breathe. How does interstitial lung disease impact lung function? Interstitial lung disease involves inflammation and scarring of lung tissue, reducing flexibility and impairing lung function, which can result in breathing difficulties. Pulmonary embolism. Pulmonary embolism occurs when a blood clot travels to the lungs, causing a blockage in the pulmonary arteries. Symptoms may include shortness of breath, chest pain, and rapid heart rate. What are the signs of a pulmonary embolism? Pulmonary embolism can manifest with symptoms like sudden shortness of breath, chest pain, and a rapid heart rate due to a blood clot blocking the pulmonary arteries. Pulmonary fibrosis. Pulmonary fibrosis involves scarring of the lung tissue, making it thick and stiff. This scarring can hinder the ability of the lungs to expand, leading to breathing difficulties. How does pulmonary fibrosis impact lung function? Pulmonary fibrosis causes scarring of lung tissue, making it less flexible. This stiffness can impede the lungs' ability to expand, resulting in breathing difficulties. COPD, chronic obstructive pulmonary disease. COPD is a group of progressive lung diseases, including chronic bronchitis and emphysema, characterized by airflow obstruction and breathing difficulties. What is the common feature of diseases classified under COPD? COPD encompasses diseases like chronic bronchitis and emphysema, all of which share a common feature, progressive airflow obstruction leading to difficulty breathing. Emphysema. Emphysema is a type of chronic obstructive pulmonary disease, COPD, where the air sacs in the lungs become damaged, making it difficult to exhale air. How does emphysema affect the lungs? Emphysema damages the air sacs in the lungs, making them less elastic and hindering the ability to exhale air properly, a characteristic feature of COPD. Cystic fibrosis. Cystic fibrosis is a genetic disorder that affects the lungs and digestive system, leading to the production of thick and sticky mucus. This can result in respiratory infections and difficulty breathing. What characterizes cystic fibrosis and its impact on the respiratory system? Cystic fibrosis is characterized by the production of thick mucus in the lungs, leading to respiratory infections and difficulty breathing due to impaired airway function. Prioritize respiratory health with regular exercise, proper hydration, smoke-free environments, and prompt medical attention for any persistent respiratory symptoms.